Let's keep this moving. We know that there's underlying health issues causing COVID-19 to impact the Black community. And Tamara, if you can highlight in layman terms those.
Okay, so, this is, I think for us as doctors, this is one of the things that I don't love as much about COVID because when people come into your office, you want to be able to give straight answers. And literally, we are learning something about this. It seems like every day there's new information and things change. And it really does feel like you're kind of going along with the flow in a sense, like this is what it is for right now. And then, tomorrow or like 2 weeks later, it's something completely different and it completely changes your whole entire outlook on this. But kind of just in a nutshell, and, briefly, this came onto the scene in December of 2019. We kind of first got introduced to it. By January of 2020, it kind of started becoming a kind of a world health emergency. And then by March, it was declared a pandemic. And what we have seen so far, numbers-wise, is I just checked the CDC's website right before we logged in just to kind of get the most accurate numbers right now and this is just the United States, and I do not have worldwide totals right now, but we are getting close to 1.7 million cases in the United States. And we have about 100,000 deaths. So it's about, the exact number was 100,446. And that was what's most recently reported. But what we have to think about is that these numbers are coming at a time when we still aren't like universally testing. Like our testing has ramped up significantly, but when we think about when this first started, we were not testing everyone. So it's very safe to say that these numbers are likely much higher than what's being reported at this moment. Initially, we didn't have a lot of information as to who was being affected, other than it seemed like it was affecting the older population more than the younger population. But as more numbers started to roll in, as people started reporting demographic information, it was becoming very, very clear that there was a health disparity being revealed. And that was pretty much that the communities of color, especially the Black communities, were being hit particularly hard by this virus. Numbers are still moving. Right now, it's still a moving target. But one of the articles that I read mentioned that we are, as a community, having about 3 times the infection rate and 6 times the death rate compared to white communities. And that is just astonishing. And so our percentage of mortality is exceeding what our actual percentage is in the actual population, which is really, really sad. And we are attributing this to some underlying health factors, which would be diabetes, obesity, high blood pressure, cardiovascular disease. So that's your heart disease, strokes, heart attacks. All of those things make you more at risk. And unfortunately, these are all illnesses that are more prevalent in communities of color. So that in and of itself is setting us up at high risk. And so from a medical standpoint, that is, what we're seeing, and it's just revealing the disparities that we already knew were there. But COVID just kind of took the veil off and highlighted what that actually means, so that when a pandemic actually comes through, the communities that are already suffering before the pandemic hit, they're going to suffer even more when it does. And so that's what we're seeing.
And does anyone have any questions? I'm just curious, we're now understanding these underlying health issues when it comes to those of us who are within the community that's being hardest hit, the Black community. And if we don't have any underlying health issues, what can we do to ensure that we don't end up having these issues? Like, what are the strategies we should be practicing? How can we check to make sure we're still good when it comes to these underlying diabetes and all of the other issues? issues that.
So from what can you individually control? Number one,
Mm-hmm.
follow the recommendations. You know, we're a high risk group. We should be the main ones who are following the guidelines. So that does include wearing a mask when you're outside, maintaining that 6 feet of distance, washing your hands for 20 seconds at least. And it sounds crazy to tell people to wash their hands, but people don't wash their hands. So remembering to do that, cleaning. But there's a difference between cleaning, sanitizing, and disinfecting. Cleaning just gets the dirt and the dust off. That's all it does. It doesn't kill anything. Sanitizing actually reduces the number. Disinfecting is what kills, and it kills bacteria and it kills viruses, which COVID is a virus. So that's using things like Lysol, that's using things like bleach solutions to wipe down your surfaces to make sure that you are killing the virus or the bacteria. You want to do that. You want to make sure that as best as you can, from a health perspective, you're setting up your body to be as strong as it possibly can to fight it. So that means going to your doctor for your regular wellness visits every year. If you're on medication, taking your medication. If you're able to eat fresh foods and home cooked foods, eat those rather than go eat out, and eat fast foods and drink soda. And, you want to try to have as healthy a diet as you're able to do to try to set yourself up to be in the best position to fight this should you get it. The crazy thing about this is it kind of evolved from being just respiratory symptoms, because we were asking people, are you having cough? Are you having fever? Are you having shortness of breath? That's all we were asking. And of course, were you traveling outside the country or outside the state? It has now morphed into, do you have all of those? But are you having a headache? Are you having sore throat? Are you having nausea? Are you having vomiting? And it's just been very, very broad now. And so almost any symptom you can see with COVID. I mean, you have the loss of sense of smell and taste. People are having red eyes. So there's all sorts of things that's going on. And for kids, that's even harder because most of them don't have symptoms. And when they do, they can look like any other infection that kids typically have. So that makes it hard. And so if you notice that you're sick and you're not feeling well, just immediately go to your physician just to make sure everything's okay. Most of us now have the capability of testing you, and you don't necessarily have to fit in such strict, rigid parameters as they were at the very, very beginning. So if we feel like, you may have had some exposure, or if you're just having a lot of symptoms that we can't quite explain, or we're just like, I don't know, it could be COVID because it does everything. Most of us now have the ability to run that test in our office. However, you're probably not going to find your results out right away because most offices don't have the rapid test. So you're usually going to find out in a couple of days. Our clinic, our turnaround is about 2 days. And so within 2 days, you'll have an answer. And so we'll usually tell you, try to stay at home if you can, socially isolate until you get your test results back.
That's great. I also want to piggyback on that in terms of our Black community is the one having the problems with diabetes and, all of these underlying issues. And in terms of moving forward, like how can we educate our community on how to prevent us from getting these issues? Like what can we start doing if we don't have them? What are the things, why I want to talk about why are we being heavily impacted? What have we not been telling ourselves? What information has not been getting to our community that is causing us to be severely impacted by these issues?
Some things are outside of our control. A lot of these things are coming from generations of systemic racism and racist policies that have just placed us in a situation where, for lack of a better term, we're almost set up to fail. For a lot of these communities that are heavy hit, they're lower socioeconomic communities, which means we're usually living in crowded housing. So you can't socially distance. You might be living in a multi-family house or a multi-generational house. So there's several people in a home and you can't social distance there. The home may not even be big enough if somebody were to get sick to say, I'm going to put you in a room and you have your own bathroom and you have your own space and everybody else can stay somewhere else. Most of, that's not possible for a lot of people. Another thing is it may be the job that they're working. They may not have paid time off, or they may be forced to work because they don't have a job that allows them to stay at home. Being able to social distance is a privilege. It really is. And if you do not have the education or the job that allows you to do that, you have to go out into the community. You're out, you're exposed. If you don't have a car and you have to take public transportation, I've just exposed myself to who knows what in that space of even just trying to go to work. So some of those things we can't really fully control. But what we can control is our lifestyle choices. So it's important for us to exercise. So exercising somehow, recognizing that every space may not be safe to do that, but trying to figure out how you can get some physical activity, even if that's just walking back and forth in your hallway in your home. Trying to manage your stress as best as you can. Watch your diet. If you're eating out every day, eating fast foods every day, that's a surefire way to gain weight. And that weight gain is automatically going to put you at higher risk for high blood pressure and diabetes. So work, doing that. If you get diagnosed with high blood pressure, take your medicine. You do not feel sick when you have high blood pressure, usually unless your pressure drops really, really low, or it goes really, really high. So take your medicine even when you feel great, because that's what's going to keep you more at a normal level. And so it's those kind of things that we need to do to try to take care of ourselves, that we can do whether or not we have the privilege to socially distance or not. Try to take care of yourself the best way you can within your community. And that may require coordinating with your doctor to be like, I can't go to the gym. I can't do this. My neighborhood doesn't feel safe. So you come up with a plan that works for where you are, and that's practical. If you got to eat out every day, okay, well, what's your favorite restaurant? Let's go through the menu and say, these are the things that would be better for you to eat. So doing things like that to try to set yourself up for a better position